Good evening, my teachers and my good friends. I am here to present on the topic choosing right catheter for intervention nephrology. I'll be talking mainly about catheters and a brief about the sheaths. And I will introduce the basic hardware which is used. So, my journey of learning about the catheter started when I joined Intervention Nephrology Fellowship in Seoul. But long before that, I attended a Avatar conference by uh, in which Dr. Hemant sir was teaching, and I attended only half part of his session, and at the end of the session, I thought that I would never be able to learn the amount of catheters and wires he's telling. It is beyond my scope to remember all these names. But because that was my first introduction to the intervention nephrology, and gradually I came. When I last time I took a lecture on Inform about the balloon catheters, I got a feedback that it was too much in detail. So today we'll try to cover the basics of all the uh, basics of catheters and sheaths, and we'll go in detail only on the catheters. This talk should serve as a reference talk for all those who are starting, mainly target all those who are starting to enter the cath lab, so that it may be easier and they may be acquainted with the instruments. So coming to the instruments, hardwares, guide wires, needles, sheaths, catheter, balloon, snares, inflation device, contrast agents, thrombectomy devices, snares, and other instruments are there. However, balloon catheters and thrombectomy devices are already covered in Inform lectures, and we will be talking mainly about the sheaths and the catheters. The catheters which I will cover are which I have seen during my training at Seoul and CMC cardiology department with intervention department and with vascular surgery. The topics which not be covered will be the balloon catheters, dialysis catheters, and hemodynamic catheters. So we'll come to the basic metric system which we use for the instruments of needles, catheters, and the wires. Needles are always measured in gauge. Catheters is always measured in French, and one French is 1/3 of a mm. So 1 mm would be 3 French. And wire diameter is always measured in inches. Wires are of various outer diameter, that is 014, 018, and 035 wires. Now coming to gauge, needle diameter is made initially. The needles or the wires were made by making a bigger metal and pushing it through a small holes. So if a wire has to be thinner, they had to be pushed multiple number of times. If a wire was pushed 10 times, it was known as 10 gauge wire. So if you pass a wire through a small hole 10 times, it will become thinner and thinner. So larger the gauge, the thinner the wire. And this was adopted for the needle. And the another origin of this terminology is from the pellet shots. So if a one big lead ball is made into many small pellets, that is known as gauge of the pellet. For example, a 410 gauge cartridge has 410 has very small pellets that is used to kill was used to kill smaller animals. And this was the origin of the metric system of gauge. So then this wheel was originated that was used to measure the metallic sheets, and the similar is adopted for needles. Coming to the catheters and sheaths. Catheters and sheaths are plastic objects which are measured in French. French system was originated by uh, Joseph Frederick Benoit Charry, which was translated to French in English. Now coming to the needle, sheaths, catheters and wires. The diameter which is used measured, if you say the 21 gauge needle, it talks about the outer diameter. A 21 gauge needle is thinner than the 18 gauge needle. Now coming to the sheaths we always talk about the inner diameter, and catheter we always talk about the outer diameter. Why? So because you can see, when I will come to the sheaths, I will tell a catheter has to go inside a sheath. You can see a sheath. A catheter has to go inside a sheath. So
హార్మోన్స్ గిర్మోన్స్ అన్ని మళ్ళీ అయిపోతాయి ఏది బయటకు పంపాల్సిన
now I'll come to the needles. So these are the needles. I hope my pointer is visible. These are the needles. Most commonly used are the 18 gauge needles and the 21 gauge needles. In 18 gauge needles comes with a hemodialysis axis set, that is also known as the single puncture needle or the introducer needle. 21 gauge needle comes with a set known as micro puncture set, and it is also known as the micro puncture needle. So this is a single puncture needle or introducer needle which comes with our dialysis set. It has a hub, it has a bevel. In the hub, there is an arrow mark. If you see carefully here, there's an arrow mark, and so I'll show you the mark in one of the needles. I hope it's visible. This is the arrow mark. So this arrow mark uh, indicates the bevel. So what is the use of this arrow mark? If you enter with bevel down, then and you proceed the wire, there's a risk of intimal damage. So once you enter the vessel, the bevel has to be up. With this needle, we use to cannulate the vessel through a Seldinger technique. Now coming to the Jelco needle. What's Jelco needle? So initially I learned micropuncture needle and then I entered the Cathlab from in cardiology. Cardiology technician used to give me Jelco. I didn't understand Jelco is the name of the needle or it's the name of the term. Finally, Jelco is nothing but an IV cannula, but it does not have the wings. So how to can it has advantages and disadvantages over the micropuncture needle. It is also used to access, but it has advantages and disadvantages. Disadvantage is that once you are inside the vessel with a Jelco needle, a steel needle can be manured inside the vessel. Suppose it is at the intima, it can be manured. However, if you are with a Jelco needle, the plastic part cannot be manured after you have entered the vessel. So usually Jelco needle is used by cardiologists for radial puncture using a double puncture method. What is the double puncture method? Penetrate the anterior wall, posterior wall, then pull back into the lumen. That is the double puncture method. And the method of cannulation of Jelco needle is known as the modified Seldinger technique. That means the needle goes along with a external cover and the needle is withdrawn then. Coming to the most useful part in intervention nephrology procedure. This is a micropuncture needle. Micropuncture needle is also known as the Swiss Army knife of the vascular access. As a rule for all the beginners, for any axis, you can directly, before going to a sheath, you can directly puncture with a micropuncture needle and introduce a micropuncture set first, then only go to the sheath. The other needle is scalp vein needle. So this is a case, we had a fistula with a juxtaanastomotic thrombosis. And the juxtaanastomotic thrombosis was juxtaanastomotic stenosis, which was plastered after opening the lumen, and the fistula was okay. Some few hours later, we found that there is a thrombosis. We had given patient had high BP, very high BP, and patient was in overload at that time, so we did not take him for another procedure. We just did a dialysis, and then we took him for a thrombolysis. As we know, this was a physiological thrombus, not anatomical thrombus. We had achieved a significant success, so we did a multiple puncture needle method. Why multiple? I have seen many intervention nephrologists also use insulin syringe to give the thrombolytic directly into the thrombus. But in this case, we used scalp needle at multiple places in the thrombus where the thrombus burden is high. The thrombolytic was diluted and given in multiple pulsed frequency. And today the patient was dialyzed with, and the fistula was completely thrombus free. So this method of pulse frequency thrombolytic administration, we can use scalp vein needle, and this comes from Dr. Amitabh Vikrama paper, was a paper, and for USG guided needle directed pulse spray pharmacomechanical thrombolysis of ST grafts and fistula. Coming to micropuncture set. What is micropuncture set? As I told you, micropuncture set consists of a needle, a wire, and a coaxial dilator. I repeat, needle, wire, and a coaxial dilator. Needle is a 21 gauge needle. Is a 21 gauge needle, and wire. This wire comes with various names. I hope the wire is visible. Is the wire visible?
Yes,
Yes, wire is
visible.
visible. So this wire has a stiff part which is made up of steel and or nitinol, and the distal part is made up of platinum. It is floppy. It can be called by a company name which is known as mandrel wire. It can be called as a name. Some people call it cope wire, and as my boss used to call it, a hairy guide wire, as it looks like a hair. So this is a wire along with the micropuncture needle. And the third is a coaxial dilator. So coaxial dilator is a tube within a tube which is 4 French or 5 French, and it can be used to access. So any small vessel, if we have to access, we access first with a micropuncture needle, then we put a uh, hairy guide wire. Over the guide wire, we put a double axial coaxial dilator or coaxial dilator, which is 4 French or 5 French. This is how we access any fistula. So this is the micropuncture set I was talking about. Now coming to sheath. My first time I saw a sheath was in my MD when my cardiologist was doing a temporary pacemaker. So that time I realized it intrigued me. So this is a sheath. Uh, as it is visible, the sheath has various color codings of different colors. A gray color is a 4 French sheath, green color is a 6 French sheath, and a orange color is a 7 French sheath. It comes in various lengths from 7 centimeter to long sheath as long as 85 centimeter. However, commonly used sheaths are 7 to 11 centimeter, 7 centimeter being called as radial sheaths and 11 centimeter being called as femoral sheaths. So these two are 4 French and 5 French radial sheaths, and this is a femoral sheath. So this sheath, what is the purpose of the sheath? Sheath acts as a conduit or a controlled axis. Once the sheath is, once the wire is inside, we tunnel the sheath inside the vessel. Now, once the sheath has entered the vessel, you can see that this our opening is blocked by dilator. Opening is blocked by the dilator. So, if we remove the dilator, the blood will come out from here. So there are two things we need to know. The blood should not come out and the air should not enter. These two bad things are prevented by this valve. So this valve is a one-way valve. From here, the wires can enter. From here, the wires can enter, but air will not enter and blood cannot come out. Now there's a side arm of the sheath and the stopcock. The purpose of the side arm of the sheath is to give contrast and give heparin flushes. So whenever we do any arterial puncture, we have to give heparinized saline to avoid clogging of the. In venous short duration procedures, the lower amount of heparin can be used or heparin is controversial. However, in prolonged procedure more than 1 hour, heparin is advised. So the side arm uses to give contrast and to give heparin flushes. It can also be used to give medications. Now come, this is the plastic axis which is known as the sheath. So once the sheath is inside, we can do our procedure through the sheath by inserting the guide wires, balloons, catheters, all go to the sheath. Now coming to the main part of the talk, overview from the catheters. So this is a introduction, length, diameter, types, and guide wire principles and examples. These are important. In materials and properties, you may choose to doze off. And what is a catheter? A catheter is any hollow tube which is inserted in duct or body is a catheter. It is introduced usually through a sheath in a vascular access site. A catheter has a primary curve, a secondary curve, or a tertiary curve. All catheters may not necessarily have a primary, secondary, or tertiary curve. So straight catheters have no curve, and some catheters have a primary or a secondary curve. I will show you when it comes. These are available in various lengths from 30 centimeter to 100 centimeter. Most commonly used catheter for our procedures are from 65 to 100 centimeters. Unless you are coming from a femoral and you are accessing a brachiocephalic fistula, you may require catheter lengths as long as 125 centimeter. But if you choose a longer catheter for a smaller short axis, the long catheter would be hanging out on the table and there are chances of contamination and the procedure would be more difficult. So the lengths which are most commonly used for our access procedure are 65 to 100 procedures, 100 centimeter, and the diameter which is used is 5 French diameter. Again, for catheters, diameter is the outer diameter, and for the sheaths, the diameter is the inner diameter. So these are the two catheters. Now, going along the talk, there will be so many named catheters. We will remember only a few, and at last in the examples, we will apply that knowledge to see how those catheters are useful in each case. So these are the two catheters. This is made by company Terumo, straight and not tape angled catheter. Now, what does the description? In the catheter, there is a hub. You can see the hub. In this hub, the parameters written are 5, 038, 65, and 1200. So this 5 indicates this catheter is a 5 French catheter and it will require minimum of 5 French sheet to go inside. Now 65 is the length of the catheter. 038, 038 is the wire compatibility of the catheter. This catheter can be used over a 038 guide wire. It can also be used over a 034 guide wire. Coming to 1200. Coming to this 1200, 1200 is the PSI, maximum pressure which this catheter can tolerate. This is mainly useful by intervention radiologists when they use jet injector. But in most of the intervention nephrology procedures, I have never used a jet injector, and most of the procedure jet injector is not used. And the maximum pressure which can be generated by hand by 5 ml to 10 ml syringe is 50 to 100 psi. So we will never be using such high pressure, so we should not fear about this value. Coming to the properties, surface coating of the catheter. So coating of the catheters. One basic rule, one of my friend told me was, all black catheters are coated and all blue catheters are not coated catheters. Coated means hydrophilic coating. And most of the hydrophilic coated catheters have a transparent hub so that you can see, and most of the non-hydrophilic coated have a opaque hub. Surface coating increases the trackability. We will come to what is the trackability of the catheter. So outer friction layer, if there is low friction, the catheter tracks to the side branches or the curves. That is known as the trackability. But when you push the catheter, it would be difficult to push. That means it decreases the pushability of the catheter. Okay. Now coming to braiding. What is braiding? Companies have come up with a property called braiding. If you cut this catheter, they might have, most of the catheters have braiding inside it. So they have steel grading or nitinol grading. This grading provides stability and strength to the catheter so that it can be pushed over a guide wire. Now the braiding can be of multiple types. It can be single braiding and double braiding. It can be of different configuration, helical grading, box grading. We don't need to remember all this. Just remember braided catheters are tougher and they are more pushable. Now coming to materials of the braiding. In the braiding, there can be steel or nitinol. If there is a nitinol grading, the catheter is kink resistant. But if there is a steel braiding, for example, this catheter, this is a hydrophilic catheter, and this is a hydrophilic catheter, and this has a steel braiding. If we fold this catheter, there will be kinks. So this is the kinks. So this catheter is not kink resistant and it has a steel braiding. Materials can be polyurethane, polyethylene, nylon. A nylon catheter is a stiff catheter, whereas a polyurethane catheter is a more flexible catheter. This catheter is made up of polyurethane, and this catheter is a stiffer catheter. It is made up of uh, It is made up of nylon. So this is a nylon catheter. Tip design. Tips are always rounded and they to minimize the trauma. Most of the catheters have tip which are non-braided. Tips are never braided because braiding increases the trauma. Reinforcement is same as braiding. Coming to torqueability. Torqueability is if I move the catheter's distal tip, how much torque I can give to the proximal tip of the catheter. That is the torqueability of the catheter. So stiffer the catheter, more torqueable the catheter. Pushability. How much force at the distal end is seen by the proximal end is seen by the distal tip. That is known as the pushability of the catheter. Braiding, stiffer materials, they increase the pushability of the catheter, but decrease the trackability of the catheter. What is trackability? Trackability is nothing but navigation. How swiftly a catheter navigates through the curves, and that is known as trackability of the catheter. A stiffer catheter has a less trackability. Hydrophilic coating catheters, this black colored catheter, is more trackable. Radio opacity, tungsten is the most radio opaque and used in most of the catheters. They are made up of atraumatic tip, have low surface frictional resistance, biocompatible, and kink resistance. For kink resistance, remember nitinol braiding is kink resistant and steel braiding is not kink resistant. Flexibility. The flexibility comes by the nature of the braiding. Helical braidings are more flexible. Now coming to hydrophilic and non-hydrophilic catheters. When do you use a hydrophilic catheter and when do you use a non-hydrophilic catheter? For example, if we have a lesion we have to cross and if the lesion is very acute and we need the catheter should swiftly go in a U shape. So we will use the angle hydrophilic catheter. In another instance, we have a vessel which is occluded and we have to uh, cross the lesion. We need more stability. In that cases, we can use a non-hydrophilic cheaper catheter and it will rest there. It will provide us stability so that the wire comes out of the catheter and we can penetrate the thrombus or a CTO. Now this is the classification. Now coming to another classification of the catheter, diagnostic versus guide catheter. So this is the illustration of diagnostic and guide catheter. Guide catheters are wider catheters, have wider inner lumen, and they serve as a conduit to deliver balloons, microcatheters, snares, and they are rarely useful for us. Most of the catheters which interventional nephrologists use are diagnostic catheters. Guide catheters are rarely useful for us. Guide catheters are more found in the cardiology labs rather than interventional nephrology labs. So when I went during my fellowship, these two, one straight hydrophilic catheter and one angle hydrophilic catheter. These two catheters did most of the job. Coming to SGPGI, these catheters do most of the job. We will try to classify the catheters as we go on. So this is the straight configuration. All these three, Bernstein, this is the longer Bernstein. These are curved catheters. And this U-shaped is known as, this is angled, sorry. This is straight, these are angled, and this is hooked. Straight, angled, hooked catheters. These are the catheters which I saw in cardiology. Now I'll enumerate only those which we use. This is a very commonly used catheter called multi-purpose catheter, MPA, multi-purpose angiographic catheters. This is a catheter known as JR, Judkins right, and this is the catheter Judkins left. The original purpose of these catheters are to engage the right and the left coronary artery. However, in our procedures, instead of this curved catheter, Judkins right can be used. this classification. Don't get scared by this classification. For coming to hemodynamic catheters, we don't need to learn about hemodynamic catheters. Guide catheters are rarely used. In microcatheters, I'll come to special catheters. Microcatheters are catheters which are less than 3 French in diameter. They can go inside a catheter. So in microcatheters, I have used only Prograde, CXI and Derrickson. These three catheters, Prograde, CXI and Derrickson, these three catheters I have used. You don't need to remember the names. Just remember any catheter which is less than 3 French in diameter is a microcatheter. Now coming to the selective catheters and visceral catheters. Among the selective catheters, all are diagnostic catheter, as we talked about diagnostic catheters. In this, we can remember as straight tip, angled, this is straight, angled, curved, and uh, curved and hooked catheters. So these are the types of catheters. These four configurations are okay to do all the purpose. Among the visceral catheters, in interventional nephrology, most commonly we will do a renal artery stenosis stenting or we'll do a renal artery embolization. To access the renal artery, there are various configurations are used. I have used only these three. I have seen in my IR lab, Cobra, Shepherd hook, and RDC. RDC stands for renal double curve catheters. So this is a slide from the ASDIN, and that again classifies the catheters into four types: straight, angle tip, hook tip, and curved tip. This is a straight, this is angled, this is hooked, and this is a curved tip. This straight catheter, I will give you examples now. Straight catheter is STS catheter, which is used in SGPGI. We saw is STS catheter. Curved catheter, angled catheter. Angled is Bernstein and Ka. Angled is Bernstein and Ka. Bernstein. Hooked is the rim catheter. And this curved catheter is the Cobra catheter. Okay. So now we'll come to the uses of each. Straight catheter. Straight catheter is used for guide wire exchange. For example, if we are inside a lumen, we have passed a guide wire. Sometimes balloon cannot be passed on a flexible guide wire. We need to exchange it with a stiffer guide wire. In that case, we will put the catheter over the guide wire, remove the guide wire, and put a stiffer guide wire. For those exchange, straight catheters can be used. When the guide wire, a flexible guide wire, is piled up inside the or coiled inside, to straighten that also, a straight catheter can be used. Coming to angled catheter. Angled catheter, I told you which are the angled catheters? Bernstein catheter. And in cardiology labs, this is the angled catheter, which is known as JR. JR, I would not classify as completely angled or curved because it has a secondary curve also. It looks like somewhat like a Cobra catheter. So that is and this is a Cobra catheter. It looks like a Cobra, and this is a JR catheter. So Cobra catheter is a curved catheter, and JR can be used instead of angled catheter when we don't have angled catheter. Bernstein. Remember this name Bernstein is the most commonly used catheter as an angled catheter for our procedures. Uh, is my video visible?
No.
Now it is visible.
Okay. Oh, I was.
No, your slide I see.
I was showing the catheters all this time. So
That's why I requested you to switch on the video.
yeah, okay. So this is I'll show it again. This is a angled catheter, glide catheter, black color. This is a
You're seeing
Cobra
only
catheter.
the slide, right?
No, sir, I'm showing the catheter. Is it my video visible, sir?
No, we are seeing your slide only.
I can see your video.
Oh. It's playing.
Okay. So this is a if it is visible in my video, there's a cobra catheter. Now, coming to this is a hooked catheter, and the name of the company is Roche Inferior Mesenteric Rim Catheter, and it helps us navigate the hairpin bends. And this is the cobra catheter. It looks like a cobra, and it helps us to navigate the side branches, to enter the side branches. Now, there are so many types of different companies. You don't need to remember, but we'll go through it so that this is only which are useful to us. This is a rim catheter, which is useful to us. It can be used as a hooked catheter. This is a vertebral, which can be used as an angled catheter. And this is a cobra's catheter of different sizes. And this is K. K is also used as an angled catheter. So don't need to remember the name. You can just remember straight catheter and angled catheters. So this is by another company again, which this is a multi-purpose catheter. These are the cobra catheters. Okay. Now the selective catheters. What are selective catheters? Selective catheters are used for visceral canalization, like renal artery catheterization. So for renal artery catheterization, most commonly we use Bernstein or Shepherd hook catheter. This is a Shepherd's hook. And can you see in the camera? This is a non-hydrophilic coated Shepherd hook catheter. If the aorta is very large, this if the aorta is very large, so we need a larger catheter which will rest here so that this can enter the renal artery. So we need something which has an occiput. So that is known as the modified Shepherd hook catheter that is used for renal artery cannulation. So different catheters are required to enter at different angles, but most commonly used are Bernstein, Cobra, renal double curve. These three can do the job of entering the renal artery. This is how we keep our catheters in cardiology. This is the date of packing is written, the expiry date is written, the French Judkins right is written. We'll try to identify this. This is JR catheter. This is JL catheter. This catheter is known as the pigtail catheter. I'll show you the pigtail catheter. Can you see this catheter pigtail? This pigtail catheter is the only catheter which has multiple side holes in which of our use, which has multiple side holes, and these side holes are used to when our catheter is in a large vessel and we need to flush the contrast and do a angiogram of a large vessel. At that time, this pigtail catheter is used. Microcatheters, I have used two Prograde and Derrickson. So when are microcatheters used? The function of a catheter is to provide support to a guide wire. Because if you manipulate the guide wire from the distal end, you may not be able to manipulate the proximal end better without the support of a catheter. The function of a catheter is to support a guide wire. So basics, this is how a catheter provides a support and you can manipulate and cross the lesion, cross the tight lesion. So initial steps, we place the guide wire across the lesion and then we use an angiographic catheter for guidance if necessary. Once the guide wire is positioned, catheter is often needed for imaging and treatment. So how do you advance the catheter? We have to advance incrementally and stop when the resistance is there. So whenever we are advancing a catheter, it should be advanced slowly and it should be always advanced over a guide wire. Catheter should not be advanced blindly. Or if you advance the catheter blindly, there's a risk of uh, entering a false lumen. If you enter a false lumen, it can be disaster and there can be dissection. And when you're entering a guide wire also, you can move a guide wire and see. If you move a guide wire and a guide wire is rotating freely, that means it is in the luminal space. If it is having some resistance or not moving freely, not curving freely, that means it is in some soft tissue. Now it can be used for removal and exchange. Exchange I already told you, for if we want to exchange a guide wire from a softer to a stiffer one, and selective catheterization. So this is selective catheterization, means if there is a eccentric thrombus or there is a side branch. In that case, we will need a angled catheter. Angled catheter, as we discussed, are Bernstein, which is also known as Kumpe, and JR, the Judkin's right catheter in cardiology. Bernstein and JR are the angled catheters. Chuang's rule. Chuang was a person who gave this rule that the length of the catheter tip distal to the primary curve and the width of the curve should be at least 110% of the vessel. So this helps us in selecting.
Tell them which is primary curve and which is secondary curve.
This is the, I'll just go back to the slide, sir. This is a primary curve, this is a secondary curve, this is a tertiary curve.
Purpose of the secondary curve is to get support to the wall of the
Support to the wall of the aorta. Like in this case, we saw this curve, this occiput supports the wall of the aorta, and this helps to enter the renal artery. So this is the Chuang's rule. This helps us in selecting the catheter, but nobody follows Chuang's rule. Whatever I have said, this is more for theoretical. Most of the interventional nephrologists or interventional radiologists go by experience. So this was the Chuang's rule I was talking about. Now coming to examples. This is a radiocephalic fistula, has outflow stenosis and near inflow, not crossable by guide wire alone. We have entered through sheath from here. Now we have to pass a guide wire here over a catheter. What catheter we will choose? We will choose a straight catheter, which will be diagnostic or guide diagnostic, because we don't need to push balloon through the catheter. Which are the straight tip catheters? Any, you can just say straight tip catheters. And I'll tell you a surprising fact: in intervention radiology department of CMC, there is no straight catheter available. We are using MPA catheter as a alternate for a straight catheter. So slightly angled catheters can also be used instead of the straight catheter. Coming to example 2, this is a cephalic arch stenosis. In this cephalic arch stenosis, suppose you have entered the through a fistula and passed the guide wire, and guide wire is not passing. So this is the region in which guide wire should pass, but suppose guide wire is not passing and you need to support the guide wire here. So which catheter you will advance till here? This would be an angled catheter. Angled catheter, as we use, if you are working somewhere where Bernstein is available, you can use Bernstein or Kumpe. If you're working under cardiology, you can use a JR catheter, Judkin's right catheter. Now this is a case of central venous stenosis in which we need to pass the guide wire from here to here. Both the sides have a catheter and a guide wire to support it. Now, sometimes catheter also needs support. So here there will be a long sheath. So there's a long sheath inside which there is a catheter. Inside the catheter there is a wire. So this approach in which we use the catheter to support the wire and cross the lesion, that is known as the mother to child approach. And in this case also we will use angled catheters which will sit over here, and on that we will pass the guide wire. So guide wire was passed, snare was passed from the above end, and this was hooked. This is known as the mother to child approach. That is a sheath, and there's a long sheath and catheter is within it. Now sometimes we put a micro catheter inside the catheter. So a long sheath of 6 French, catheter of 4 French, and micro catheter. Micro catheter by definitions are less than 3 French catheters, So this triaxial system is known as mother to child to grandchild approach. It is one of the approach used to cross the CTOs. Now example 4, AVF with juxtaanastomotic stenosis and not crossable by guide wire is not able to pass through here. We have to pass the guide wire from here to here and it's not being able to pass. So we'll have to use a catheter which can accommodate in this hairpin bend. That is known as U-shaped bend. That is known as the rim catheter, hooked or rim catheter. However, if hooked or rim catheter is not available, you can use a normal angled catheter also, again Bernstein or JR. In the case of renal artery, example, renal artery stenosis, you have to undergo, then either a angled tip catheter can come from here or a shepherd hook or a modified shepherd hook catheter can be used to enter the renal artery. So this is a shepherd hook catheter which was used. Coming to New York and Oxford, new catheters are costlier. They have more smooth procedure and they can be always visual inspection should be done. And old catheters are also known as Oxford catheters and have less carbon footprints. So this is our lab where we dip the catheters and sheets in the side X, then wash them under water, and then they are packaged after thorough cleaning, and the dates are being written. That was all. Thank you.